Namaste Andi. I'm Nandakishore from GAMAN Health Center, Integrated Wellness and Interventional Rehabilitation Facility. Today we have Sana, our physiotherapist.
Hi sir, I'm Sana Tabassum, physiotherapist working at GAMAN Health Center.
Kaushik, our physio.
Hi sir, my name is Kaushik. I'm working as a physiotherapist in GAMAN Health Center.
And Jaimol, our respiratory therapist with us to discuss about those patients who are recovering from COVID, those who are at around 5 liters of oxygen, gradually weaning off the oxygen, and this is the phase where they might still need oxygen supports, and this is the phase where our team is actually motivating them, pulling them out of the bed, encouraging them to stand up, encouraging them to sit for longer period of time, encouraging them to attend all their activities of daily living. This is a phase for those people who had mild, moderate symptoms is not a big deal. But for those who fought hard, who are in ICU for longer period of times, who are on ventilator for longer period of time, who are on NIV, is very physically and emotionally strenuous moments, challenging moments, complex moments. Because of the long-term use of medications, steroids, complex scenarios like diabetes, nutritional deficits, this was the time where you have to focus on improving muscle strength, endurance, cardiopulmonary efficiency, giving them lot of motivation to come out of the bed. How these guys have actually done it, let's know from them. Sana,
Yes sir.
thanks for joining today in the first place. And you had a special interest in working with those patients who have long COVID, who might be on ventilators or NIVs, and then slowly coming out. You worked both in the ICU setups and especially worked in the wards where they are weaning off from 5 to 0, 0 to 5, those fluctuations, those panic moments. So as a physiotherapist, our primary challenge is to encourage activities of daily living.
Yes.
Where you started and what was your goal?
As they were in ICU for some patients are in ICU for longer duration, like 10 to 15 days. So they get generalized weakness as they are in one position for longer duration, like in supine position or lateral side positions. They get body ache, fatigue, body pains, and weakness in their body. So they can't do their works, their activities of daily life in routine manner. So we teach them from beginning, from lying to sitting, for how much duration they have to sit, and what activities will say, and they'll proceed with those activities.
So when they were actually attempting to sit after a long time on the bed with heavy oxygen, their heart rate might slightly go up.
Yes.
And their saturations might vary.
Yes.
Right? How did you motivated them to relax? How your chest physiotherapy, your percussions, your exercises, which one actually helped you the most? What is that specific technique or an exercise in these patients helped you the most?
The most was relaxed breathing exercises, because as they were in really panic mode, so we just asked them to relax and breathe in and out 5 to 6 times. Later, as saturation levels got stabilized, we moved on to other exercises.
Fantastic. What I have observed in the patients with long COVID is a massive reduction in the strength of pelvic floor muscles and core muscle groups, and because of long immobilizations and various medications, the bone densities are also coming down. Right? The actual goal to achieve these functional outcomes is to enhance core strength and pelvic floor.
Yes.
So what is that specific exercise which helped you to improve core strength and pelvic floor movements?
For core strengthening, we went for pelvic bridging.
Fantastic.
We asked the patient to lift their pelvic and hold it for 5 to 10 seconds. It varies between each patient. So we did repetitions of 10 to 15 repetitions on every patient. This was one of the exercises. Others were pelvic tilt,
Abductor strength. Yeah, you did pelvic tilt.
Pelvic tilts, side turning stretches, gradually increased core strength, and
we started working on pelvic tilts. then improved core muscle strength.
muscle
We
strength.
encouraged them to do bridging,
Bridging.
and gradually then onwards increased frequency, intensity and repetitions. Okay.
We started with doing pelvic bridging and pelvic tilts for their core strengthening. As they were doing those exercises, we increased their intensity and duration of the exercises.
Fantastic. Kaushik, it's a pleasure to have you here.
Thank you, sir.
I remember when the COVID scenarios came up, I requested people to voluntarily come forward and see whoever is interested to fight, because there is a lot of uncertainty. And I still remember Kaushik is the one who raised his hand first. He always looks for trouble, who looks challenges. Okay, on good note, he wanted to help people out of the box. And in a setup where we are talking about people who are coming off the ventilators, off the NIVs, people who are coming from around 10 liters to 5 liters, and here today we are discussing about people who are coming off from 5 liters of oxygen to no oxygen, is the time where they have to stand, walk and put first few steps in the ICU, and that is the phase when they start believing that they'll go out of the ICU, go out of the mask, go out of these pipes. Is still a challenge as a physiotherapist to mobilize him inside that chaotic environment and to still encourage them to come off the bed and gradually go to come off the beds and attend their activities of daily living. So in these circumstances, Kaushik,
Yes, sir.
how happy you are or how challenging it is for you when they are recovering from COVID and taking their first few steps?
I'm very happy that they're taking the steps, but I am very scared because of the saturation levels, because they came down from ventilator, NIV, HFNC, high concentration mask and face mask and nozzle pump. So we have to check frequently the saturations, and we have to encourage them, I encourage them to take the steps. So for taking steps for walking, we did isometrics and ankle pumps. And
Kaushik, what was the tool which helped you the most? There is a lot of talk on 6 minutes walk test, 6 minutes walk, and I know that this is the phase where you are judging the people whether they are partially independent or they still need support depending upon those 6 minutes walk. When they are having that close to that 4.5 minutes and they are finding it difficult before their saturations are dropping, it is really the sense of fear, failure when they are at the verge of victory. They are almost there, but they have to just complete that 6 minutes walk and maintain those saturations is emotionally and physically challenging. What are the simple exercises which helped them to gain this cardiopulmonary endurance? And what are the movements you forced or recommended patients to do?
we encouraged patients to do ankle pumps, isometrics and core muscle strength exercises, and we asked them to do respiratory exercises like chest expansion exercises, and we asked the patients to do spirometry, intensive spirometry, ROMs like shoulder movements, mobility, and
All those exercises helped you a lot.
Yes.
But doing at regular intervals, making sure that they are not getting fatigued, and by doing continuously they should not get their saturations drop, and along with their saturations their confidence level should not drop. So it is not just encouraging and motivating and pushing them, but holding it, relaxing it and giving them recovery time is also crucial. And I'm very happy that Kaushik and his colleagues did an amazing job. Thank you, Kaushik, for being with us and being a motivator to the group and encouraging people to take it and being able to work on odd hours. All the long nights are enjoyed by Kaushik, and keep it up, man. A long way to go.
thank you.
And keep working and help more people. God bless you. Sana, I would like to thank you for your wonderful work in those long hours in peak summers with those energy exhausting PPE kits,
Yes, sir.
standing working on for hours together and saving your energy, and your lunch sessions are delayed, and you guys did a wonderful job.
Thank you, sir.
I want you guys to continue with the motivation, continue with the same spirit, keep learning, keep improving, and take it forward.
Yes, sir.
Right. All the best.
Thank you, sir.